Yes, that of course is one of the basic advisory that people should refrain from venturing out, especially when the temperatures are peaking around afternoon. Let me bring in Dr. K K Aggarwal, who is the former chief of the Indian Medical Association. Good morning, Mr. Aggarwal. Your thoughts on the current situation in North India, because currently the scorching heat is affecting people at large. There are also heat-induced illnesses that happen at this time. What would be your advice to people in those parts which are reeling under this kind of a heat wave condition?
When we talk about heat disorders, we talk about heat cramps, which is a milder form, and then heat exhaustion, and then heat stroke.
Yes.
When it comes to heat exhaustion, you have fever with sweating, and fever without sweating is what is a heat stroke. The heat stroke is a medical emergency. And the test for the people is armpit. If your armpit is dry, it is dangerous. If your armpit is wet, it is fine. So therefore, if you are experiencing any type of a heat disorder, you need to hydrate yourself, and you need to take a lot of salt water. So specifically, when we talk about shikanjvi, which is a classical heat disorder removing substance which contains lemon water with salt and sugar.
Yes.
Or you can have amma pan ka panna, which is basically a kache aam ka water. So therefore, proper hydration is the most important thing, and then use umbrella if possible.
Okay.
Don't go directly in the sunlight. And normally, whenever in summer, we have to take 500 ml of extra fluid. But if you are going out, you may require around 1 liter of extra fluid with you. So these are the precautions needs to be taken.
Yes, so very important advice coming from Dr. K K Aggarwal. The idea is to keep yourself hydrated, and lemon juice and aam panna is what Dr. Aggarwal recommends. Also, you know, Dr. Aggarwal, at the time like this, people experience reduced productivity. Of course, outdoor activities naturally reduce. So that also has some sort of a ripple effect on the people at large.
Basically, hydration is the only answer. Keep hydration and make sure that your fever, if you have fever, don't allow the fever to go up. And if the fever is more than 104, and remember in heat stroke, when the fever is more than 104, the paracetamol will not work. The only thing which works is tap water sponging. So these are the precautions needs to be taken.
All right. Thank you so much, Dr. K K Aggarwal, for joining us and for giving us a very healthy advisory, which people must follow, and also look out for those heat disorders.